Hi, Mohammed Moin from Pakistan, and like to thank the organizers, especially Dr. Meena for inviting me to this talk on professionalism to the IUS conclave at the AOIS organized by AOIS. And today we are going to talk about professionalism and how would you teach professionalism. This is a very interesting topic, which I found was quite challenging, but more or less, let's get on with it. And the objectives of the talk are the participants should be able to define professionalism, explain the importance of professionalism in various fields, and discuss various methods to teach professionalism. So professionalism is not a job you do, it's how you actually do the job. And when you ask people, what is professional person or how did you learn professionalism? People usually say that it's through the various role models in our life, which are teachers, maybe our patients, our mentors. They taught us about professionalism. It is not there in the lectures or in the books. The characteristics of professionalism, if you just outline a few of them, there are a lot of them, but the things which are most important is if you are professional, you should have good grasp of knowledge of and the job you're doing. You should be competent, you should know, and you should be confident in how you deal with that patient. The patient will exactly know in a few minutes that you're competent enough to do the job or not. Honesty and integrity, especially in challenging situations when you think there's a difficult decision to make and there is something in which ethical concerns are there. A professional will always maintain his integrity. He'll always stick to his words and be honest all the time. And he's always find a professional person, he'll always be accountable. He'll always justify what he says, and he has justification about how he talks about it. Then ability to control yourself is self-regulation, and there are different ways to do that. And a professional will always be able to self-regulate themselves. His appearance will be immaculate, he'll be well-dressed. That is part of a professionalism. People not dressed in jeans or probably not very adequately unshaven coming to work, probably they give an appearance of an unprofessional person. And a professional person will always communicate clearly, precisely what he wants to know and talk about. And time management, I think, is the most crucial part of a professional person. He will not be there talking here about, he'll be to the point and what needs to be done in the shortest period of time. Those are the characteristics of professionalism. So the question comes in, why do you want to teach professionalism? It benefits for the individual who you are teaching to. It benefits the organization, and it impacts on career advancement of people. And if you've got professionals in your organization, obviously you're going to work much better, much smoothly with a lot of coherence. The learning of professionalism often takes in the hidden curriculum in schools and colleges because it's sometimes not there in the books. It's what's happening in the campus and how it's happening and how the institution plays its part in controlling how things are happening. That is how they're teaching professionalism. And it's seen and heard in informal planned sessions, such as in clinics or wards or in the corridors. How your teachers used to talk, how they would come at night to see their patients, to do their duty, not that they're getting paid for anything. Selflessness is the altruism that actually tells you that he's a professional. The teaching methods are incorporating professionalism into your education. the role of educators in modeling professionalism, and the use of case studies and real life examples are the teaching methods which we are going to deal with. Let's see. The first one is a small group case discussion. You can have role modeling, as we discussed. Storytelling or narrative medicine is one of the most powerful tools of teaching anything, and that professionalism is one of them as well. Reflective practice, simulation, peer-assisted learning or PALS, guided discussions, and move on to small group discussions. Discussion of ethical challenges. That suppose you had a person you were going to operate on and he ran into a complication. How are you going to explain that ethically to the patient's relatives after the operation, and how you're going to handle him? That a small group discussion can be held on that. And the point of discussion not being to arrive at the correct answer, but to examine all sides of the argument and to appreciate the complexity and difficulty to make a decision without an agreed official code of ethics. So that's, I think, one of very, very powerful tool. Role modeling, I think, when I started learning, teaching, preparing this lecture, I think this was the only method that you could teach professionalism, but there are 8 or 10 methods you can teach. But this is, I think, which I use quite a lot, is involved consciousness and unconscious activities. Faculty displays knowledge, attitudes, and skill. You have to control yourself when you're teaching or training somebody with you, so that they learn from you, they learn good habits from you, and they inculcate them themselves. And the person who's role modeling demonstrates and articulate expert through processes and benefits highly professional characteristics of behavior, which we seen that when we were children, we would go and see movies and our hero was Batman, and we would copy them and we'll try to make him as a role model, do as he is. So it's very easy to sort of train people by doing role modeling. Storytelling or narrative medicine is very important in teaching, and teaches through case examples. It gives moral guides to a living good life, stories of witnesses that compel us to re-examine accepted medical practice, such as stories, those in doctor stories and letters to a young doctors. How can you forget stories which your teachers used to tell? That when we were in med school, our teacher, we just remember that a teacher would come and he would tell about the stories, how he used to be in London and how he was taught over there by one of his professors, and how elegantly he taught and what principles he taught them, and with adequacy. And that is something which you remember. Reflection, to look at yourself in action, thinking on your feet, and then reflection of action on action is after the fact, and reflection for action is used to improve future practice. I think that is one of the most important things with which you can correct yourself, which you can improve your reflective thinking. So if you are a professional and you think about yourself, that how you can ask your students to go and think about what they did wrong at the end, and that will tell them if they did anything professional or unprofessional and how they can improve themselves. It's a critical appraisal of one's experience, and it requires the ability to observe one's own surrounding and oneself. Simulation, with the invention and invent of new knowledge and simulators, and we are moving from traditional practice apprenticeship model of seeing one, do one, to teach one, because patients are humans and you don't want to just do one and teach one. You want to go through a simulation so that you get a graduated approach to achieving independence, the cognitive apprenticeship model. This is a form of experiential learning that allows trainees to practice a procedure or clinical scenario in a similar environment before treating actual patients. You see, it's a very important part of getting to learn professionalism, so that you are very professionally tutoring your patients. Then we've got peer-assisted learning. People from a similar social groups who are not our professional teachers helping each other to learn. Senior residents teaching junior resident, I think that is a very good role model to teach the professionalism, and trainees sometimes find it's easier to learn from their peers rather than from their teachers, and it's much less intimidating learning from them rather than from the faculty. And peers are often more in touch with the educational needs of the trainee and their preferred ways of learning. And then in the end, we've got guided discussion in which the exposure to a variety of diverse perspectives is the opportunity to present content while drawing out lessons from different experiences. Faculty outlines in advance the procedure, and the participants are warned to wrap up some discussions to cover more areas and mentor, encourage, and guide reflection of the content. So those are the many methods through which you can teach professionalism. And you can incorporate professionalism into education. And we've already gone through this slide. And then whenever you teach something, you need to assess and evaluate. I think in the interest of time, we'll just leave that for the next session. The strategies for assessing professionalism, feedback, and recognizing and reporting professionalism. So these are the assessment tools which you can use, and I'll just briefly show you them. We'll not discuss them. The simulations for paper-based discussion, for paper patient surveys, self-administrated rating scales. So in conclusion, professionalism involves consistently achieving high standards, both visibly and behind the scenes. So you have to work very hard for being a professional, and in order to get to that area, you have to get to that level, and you have to be persistent and patient and show your best behavior and your qualities, which you have learned all of your career. Thank you very much again for the organizers, and looking forward to seeing you in the future.